Kim, thank you so much for joining us here on Health Connection. Glad to have you. This is your first time. We're talking about something that's on everybody's mind every day, sleep. And the title of this segment is Sweet Dreams, How Sleep Can Be Better Than Ever. And it's a huge topic. And let's start off right away. How important is a good night's sleep?
Good night's sleep is very important. It's a basic biological need. Without a good night of sleep, you don't function well. You have mood swings, memory loss, irritability, and serious health consequences.
What are the most common sleep disorders?
The most common sleep disorders are obstructive sleep apnea, restless legs, insomnia, and narcolepsy.
And how do you know if you have a sleeping disorder? Are there some common symptoms to look for?
There are some common symptoms to look for depending on what your sleep disorder is. There's several different kinds and it can affect you at any stage in your life. Sleep apnea, it's very common for people to snore at night, to gasp, choke, wake up having panic or anxiety attacks, nightmares. During the day, you'll have excessive daytime sleepiness, fatigue, irregular heartbeats, difficulty staying awake at inappropriate times, like if I were having a discussion with you and fell asleep.
Okay.
Restless legs, a lot of patients describe that as a creepy, crawly, tingly sensation in their legs, the overwhelming urge that they have to move their legs. They have to get up and walk around. Some patients complain that about the time they're ready to go to sleep, their legs want to get up and exercise.
Mm-hmm.
Narcolepsy is also another overwhelming urge to fall asleep at inappropriate times. You just cannot resist the urge, no matter how hard you struggle. A lot of those daytime symptoms, some patients may have all the symptoms, some patients may only have a few symptoms. You can have the hypnagogic hallucinations, which is where you dream you have actually done things that you've never done. You can have sleep paralysis, where you go to sleep and you consciously wake up, but your body does not wake up. You cannot move for a short period of time. You can also have episodes of cataplexy, which is an uncontrolled loss of muscle. If you get excited or nervous or scared or startled, you can lose control of your muscle tone, and you can fall to the ground and hurt yourself. Insomnia can be a couple of different kinds. There's an acute and a chronic insomnia. We like to classify that as, do you have a difficulty falling asleep, maintaining sleep, or do you just wake up too early in the morning?
Mm-hmm. With respect to snoring, which is common, does that always mean you have sleep apnea, or is it just to indicate that you might?
No, snoring doesn't always mean that you have sleep apnea, but it is always an indication of a partial airway collapse. Partial airway collapse is never good.
Okay.
So we need to look at it and we need to classify it as to how severe it is. Is it purely just snoring, doesn't interfere with your sleep, or is it so severe that your airway obstructs, you don't breathe, you don't get oxygen, and we need to treat that?
So you say need to treat that. If you think you may have a sleep disorder, when in that thinking process does it become time for you to see a sleep disorder specialist?
Any time is a great time to see a sleep disorder specialist. Even if it's just a transient sleep disorder, let's say you've got jet lag, or you've been pulled to a rotating shift and you're having trouble sleeping, you don't get your regular sleep hours. If it's just a day or two and you're able to overcome that, then it's not an issue. But if it becomes something that keeps resurfacing or comes back or turns into a chronic problem, it's definitely a good time to talk to your doctor. A lot of patients come in and they talk to their doctor about their diet, their exercise, any other health concerns. That's also a great time to talk to your doctor about how you sleep.
So sleep disorders, how are they diagnosed?
You can come in, there's a couple of different ways. Usually we recommend that you come in and you see one of our board certified sleep specialists. We have 3 on staff here. We have 2 adult and 1 pediatric. So we test all patients from pediatric all the way up. You come in, you have a consult with one of our doctors. Sit down, talk to them, tell them what you're doing. If you're snoring, do you snore every night? Can it be heard all the way down the hallway? Can it be heard from the neighbor's house? Is it every night? Is it only on nights when your allergies are bothering you? Or is it only on nights when you're really tired? Is it something new that started to happen to you with a certain medication you're taking that now you can't sleep at night? Come in, discuss that with our doctor. Bring your spouse with you so they can kind of witness and say, yes, absolutely, I have seen them stop breathing in their sleep. You know, or they wake up, they're confused in the middle of the night. They don't know what's going on. Any kind of issues they're having at night when they're asleep, it's good to have somebody there that's witnessed it, because most people I know don't stay awake to watch themselves sleep. So they're not really an accurate witness.
Walk us through the process of a sleep test.
When you come in for the sleep test, most of them are conducted at night. So we'll have you come in the evening hours. While you're here, I kind of consider you a captive audience. So if I'm already going to hook you up and record data, I'm going to try to get as much data as I can. So I have all the information for your physician to look at and review and make an educated decision as to how best to treat you. We hook up EEG, so we monitor your brain activity, we monitor your muscle tone, we monitor your heart rate, your oxygen levels. Some people have leg cramps when they sleep. We'll put some stickers on your legs, a couple of belts around your tummy to monitor your breathing, a flow sensor under your nose to help us differentiate any kind of sleep disorders you may have. We'll record that data all night long. There's a couple of different types of tests. The first step is usually just a diagnostic test where we bring you in, we monitor you, we observe you, we see, can you sleep? How well do you sleep? Do you snore when you sleep? Do you kick your legs when you sleep? We record all of that information. We also look for anything else that could possibly be abnormal. Seizure activity, talking in your sleep, walking in your sleep, fighting in your sleep. We put it into a nice little report, forward that to the physician, let the physician review that in addition to any other useful information, maybe some labs, x-rays, those kind of things, and then make a decision as to how best to treat your sleep disorder.
With respect to sleeping tests, we now know that you can do them. They're at-home sleeping tests. How effective are they, and what will they uncover?
They're very effective in the right patient. They're not appropriate for everyone. A home sleep test is a great way to save a little bit of money if it is indicated for you. It's not for everybody. If you have an additional health issue such as a cardiac disease, a lung disease, COPD, you're not able to hook yourself up to the monitor, then it's not for you. In some cases, the home sleep test doesn't always provide as much valuable diagnostic information as an in-lab test would.
Children, do they have sleep disorders, and if so, how are they diagnosed?
Absolutely. Children, we see children from 6 months up. You know, a lot of different things. A premature baby can have some apnea of prematurity. They may have enlarged tonsils and adenoids. They can have limit setting behavior disorders where they just don't want to go to bed. They resist it. There's all different kinds of sleep disorders, and they also can apply to pediatric patients as well.
And how do you diagnose them? Is it different from diagnosing them with adults?
It's the same way as diagnosing in an adult. You come in, you talk to a pediatric sleep doctor, they'll do an assessment on you, determine whether or not a sleep study is indicated, and if it is, you'll come to the lab and we'll hook them up the same way we do for an adult. Follow the same path.
How serious are sleep disorders if they aren't treated?
They're very serious. A lot of studies nowadays are linking untreated sleep apnea to cancer, diabetes, high blood pressure, stroke, and heart attack. Something we've known for years, and now we've got the scientific data behind it.
In addition to seeing a sleep specialist, or maybe instead of, if we've gone to that point, what can we do to get a better night's sleep?
There's lots of things you can do, and the most important thing is sleep hygiene. Go to bed and wake up at the same time every day. Weekdays, weeknights, holidays, everything. Keep a regular schedule. It's one of the hardest things to do, but it's one of the best things to do. If you always go to bed at 10 o'clock at night and wake up at 6 o'clock in the morning, you know you're going to get good sleep. Tried not to exercise within 4 hours of bedtime. Don't eat large meals before bedtime. Reduce your caffeine and your alcohol intake at bedtime. Just start with the really simple things first. And then if you continue to have problems, come and see a sleep physician and see if there are other behavioral modifications that you can add to that might improve your quality of sleep.
Very good. Kim, thank you so much.
Thank you for having me.